You are watching Beyond the Myths, educational resource for mental health and addictions, with Dr. Boat, the show where science meets soul. I am your host, Dr. Boat, researcher, therapist, author, and educator. Each week, we explore the truths, struggles, and breakthroughs that shape how we heal, grow, and recover. It is time to move beyond stigma, beyond fear, and beyond the myths. Today's topic is the clear breakdown of situational versus clinical depression. Let us begin with situational depression. Depression isn't one size fits all, and understanding the difference between situational depression and clinical depression can make a big difference in how people seek help and recover. Let's break it down in simple terms, beginning with situational depression. Situational depression is often called adjustment disorder with depressed mood. It is a response to something difficult that is happening in your life. This type of depression is triggered by a specific event or stressful events. That could be a divorce, losing a job, financial stress, or the death of someone close to you. Symptoms usually start shortly after a specific stressful event. And the key thing to know is that situational depression is often temporary. As the situation improves or as you adapt, the symptoms usually ease. For most people, symptoms ease within a few weeks to about 6 months. Common symptoms include feeling sad, tearful, or hopeless, anxiety or constant worry about the situation, trouble sleeping or focusing, change in appetite, low energy or fatigue, withdrawal from loved ones or social activities previously enjoyed, increased absence from school or work. Treatment often focuses on short-term support, and this might include therapy, stress management tools, support groups, learning healthy coping skills. Medication can be helpful too, especially if symptoms feel intense or don't improve over time. Please talk to a licensed clinician for therapy. For medications, please talk to your primary care physician or psychiatrist. Now let us talk about clinical depression. Clinical depression, also known as major depressive disorder, is different. It doesn't always have a clear trigger. Sometimes it shows up after a stressful event, but other times it seems to come out of nowhere. It's often linked to a mix of biology, psychology, and environment. The onset can be gradual or sudden, and it is not tied to a specific situation. Recovery typically begins within 3 months of onset, and without treatment, they often continue, return, or become long-term. Symptoms can include ongoing sadness, emptiness, or hopelessness, loss of interest or pleasure in things you used to enjoy, changes in appetite or weight, sleeping too little or too much, low energy or constant fatigue, feelings of worthlessness or excessive guilt, trouble concentrating or making decisions, thoughts about death or suicide. Treatment usually requires more structured care. This often includes therapy, such as cognitive behavioral therapy, CBT, acceptance and commitment therapy, ACT, or solution-focused therapy, SFT therapy, medication, and lifestyle changes. For many people, long-term management is needed. Key differences to remember. Here's the simplest way to think about it. Cause: situational depression has a clear external trigger. Clinical depression may not. Length: situational depression is usually short-term. Clinical depression lasts longer and can return. Severity: clinical depression tends to be more intense and can seriously affect daily functioning, including safety. Diagnosis: a mental health professional looks at symptom history, duration, and severity to tell the difference. A final word: both forms of depression are real, valid, and treatable. Situational depression is often a normal human response to stress. Clinical depression is a medical condition that usually needs more intensive care. Neither means you are weak, broken, or failing. Getting help early, whether through counseling, support from others, or medical treatment, can make recovery much smoother. If you are struggling, you don't have to figure it out alone. Help works, and you deserve support. If you are at imminence of risk or danger to yourself or others, please call the crisis helpline in your community. The 988 Suicide and Crisis Lifeline is available for residents in USA and its territories. You may also call 911 or go to the nearest emergency room in your community. Thank you for watching Beyond the Myth. your educational resource for mental health and addictions. Keep learning, keep healing, and keep going. Beyond the Myth. Find tools and educational resources at Neymark CPN at drboatauthor.com. Check the bookstore. Please like, subscribe, and share this video.